Hi everybody and welcome to the Kidney Coach YouTube channel. I am naturopath Fiona Chin and co-creator of the Kidney Disease Solution, as well as being part owner in Genesis, which is our supplement range that goes along with that. And I'm joined today by the amazing, wonderful Emily Cahill. Emily is a fully qualified registered nurse. She works at a large cardiovascular unit here in Melbourne, Australia. She's also a fully qualified naturopath and she has a special interest in all things kidney and related diseases and all things cancer, which I know is Emily's big passion. She worked in an oncology ward there for a long time before you switched across to cardiovascular, didn't you, Em? So she does a lot of work with cancer patients. I know that's a particular passion of hers. She's also a very integral part of the Kidney Coach team. If you've ever emailed our support desk there, you'll either get an email from Emily or Rachel, who is also a qualified naturopath. Emily is also our only fully qualified naturopath that can support people through the Kidney Disease Solution program, on top of Duncan and I, Duncan and I don't have time to do that anymore. So the amazing Em does that for us, and she writes our Facebook posts and helps me write articles, as well as helps me do all these videos. So she's got a very good knowledge of kidney disease, because really, I guess you and I live and breathe this thing day in, day out, between emails, writing stuff, doing content, creating formulas, all of that sort of stuff. Kidney disease is a bit of our life these days. So very fully qualified to go into what we're speaking about next, which is sarcoidosis, which is probably a lesser known cause of kidney disease. So let's just get straight into it, Emily. What is sarcoidosis?
So sarcoidosis is it's I guess classified as an inflammatory disorder, and it can affect different organs and different tissues in the body. And what happens is they don't really understand exactly what the cause is, but they think it's to do with the body's immune response to some sort of unknown substance. There are potentially some links to some bacteria, viruses, chemicals and things like that, but the immune system it starts to respond to whatever it is, and as the immune system does when it's trying to heal something, it causes a lot of inflammation and the release of different inflammatory molecules and immune cells and cytokines and things like that. Usually what happens, and what's supposed to happen, is that after the threat has been neutralized, or the substance is no longer present, then our immune system calms down and that inflammation all resolves and all stops. In sarcoidosis, for some reason, this inflammatory response doesn't switch off. And so what we end up getting is immune cells that start to clump together. So they start to group together and develop into these things called granulomas. So granulomas are small clumps of immune cells that can actually form anywhere in the body. There are some sites that it's more common to develop these granulomas. So the lungs is probably the most common. And then the skin is another area that's up there as well. But they can develop in any organ. So you can get them developing in the kidneys. They can develop in the heart. So yeah, basically lymph nodes, and the eyes is one of the other more common affected organs of these granulomas.
What are the sort of symptoms? So how would someone know that they had sarcoidosis? What are the sort of things that come on early on in the disease, and then as the disease progresses, what happens?
Yeah, so it's one of those diseases that tends to be tricky to diagnose, and people can often have symptoms over a long period of time and see multiple doctors before they actually end up getting a diagnosis. And the symptoms tend to depend on where the granulomas have developed. So, for example, when like the most common site being the lungs, people can get things like a dry cough, shortness of breath, a bit of a wheeze, some chest pain. If it's sarcoidosis of the skin, then people sometimes get a bit of a rash with sort of these reddish purpley bumps, or even sort of lumps under the skin, which are the nodules. They're the granulomas. Things like lesions on the nose or the cheeks as well. The skin might change colour, so you might have areas of darker or lighter skin. for people with sarcoidosis of the eyes, blurred vision, pain, burning or itching. And then some of the, I guess, more systemic symptoms, and this is probably one of the reasons why it can be difficult to diagnose, are things like fatigue, weight loss, fevers, joint pain. So, you know, all being symptoms of a number of different conditions. If sarcoidosis affects the kidneys, then some of the symptoms are, again, similar to other symptoms of kidney disease. So reduction in kidney function. People can be more prone to things like dehydration, signs of inflammation, and then probably the most common is kidney stones. And calcification in the kidneys.
It's the calcification. Yeah, okay.
Yeah. So one of the things that happens with sarcoidosis is that we get an increased production of our active vitamin D. And so this is from the granulomas. So the granulomas actually, increase the production of active vitamin D. One of the roles of vitamin D in the body is to increase the absorption of calcium from the gut. So one of the other, I guess, signs in terms of on blood tests is that people with sarcoidosis can have elevated calcium levels in their blood, but also elevated calcium levels in their urine, because if we've got too much calcium in our blood, our body, you know, does the right thing, tries to get rid of it through the urine. And then we've got the high calcium, and then that's a risk factor for developing particularly calcium, either oxalate or phosphate, kidney stones, having that elevated calcium in urine.
Yeah, and there's another condition that's really common in sarcoidosis, isn't it? Is it institutional nephritis?
Yes, yeah. So you can get some interstitial nephritis as well, which is when the nephrons, so the spaces around the nephrons, start to become inflamed, and that can be a cause of kidney damage and kidney disease as well.
And are there any particular risk factors? Like, are there, you know, is it a disease where, I don't know, if you've age, or is it a genetic thing? Are there certain medications or other medical conditions that will increase the risk of something like sarcoidosis?
Yeah, so while they haven't really particularly figured out the exact cause, we do know that some people are at higher risk. So it can happen at any age, but it's more common in people between the ages of 20 and 40.
Yeah.
It's more common in women. And yeah, I know, always. And there is some sort of genetic link. They haven't particularly, you know, worked out a specific gene or anything, but you're at higher risk if you have a relative, a close relative with sarcoidosis. And I remember when I reading about, also they were finding it, and this may be to do with more environmental type causes, but in like groups of the population as well. So you know, in a certain area, more people, like they'd have people, you know, a higher level of sarcoidosis than in the rest of the population. So there is a bit of an environmental type link. So they think things like insecticides, mold, you know, people in farming communities, and things like that. And then also there's some medications as well can increase the risk.
I think I did read too that people that live under landing strips, like near under the flight path, especially as the plane's coming down, have an increased risk of quite a lot of autoimmune diseases. But I'm sure sarcoidosis was one of them, actually, from an old seminar that I was at years ago. But yeah, I remember that one too. Okay, so we know quite a bit about sarcoidosis, and obviously kidneys being one of the area it affects, and then you talked about the lungs and the liver. So what do we do? We talked about signs and symptoms. So what do we do to treat this thing? And actually, let's start with the prognosis. So if you have got a diagnosis of sarcoidosis, are you going to go on in to get kidney failure? Is that a sort of inevitable sort of thing that happens? So sort of what's the likely prognosis for someone being diagnosed with it?
So the prognosis is really variable. So you have some people, and generally these would be people with less severe symptoms who actually don't need any treatment and end up going into remission with nothing having been done.
Right.
And then you have other people who have more severe symptoms who can, it can go on in certain cases to cause death. That's generally when the prognosis is generally worse when the heart's affected and when the brain's affected, or if the lumps are large enough to have caused damage. So whether that be, damage to the kidneys, damage to the heart, damage to the lungs, because it also can come along with scarring. But yeah, really variable type prognosis, with some people not needing any medical treatment at all and going into remission.
Okay, so there's some good news in there. So it's not definite. It's not a definite thing that'll lead to kidney transplant or dialysis.
No,
Okay.
not at all.
Great. And so what do we do to treat it?
Yeah, so from a medical point of view, so if people are being treated medically, they often use steroids. And so what they're trying to do is trying to reduce the inflammation, because that then also goes on to reduce the damage that can occur in the structures wherever the granulomas are. So that's one of the common medical treatments. And then for people who steroids don't work, then they look at immunosuppressing medications. So I guess when we're looking at it from a natural medicine point of view, we're trying to do the same thing. So we want to work on reducing inflammation, and we want to work on that immune modulation as well. They're probably the two of the key. Yes, I know. Surprise, surprise. Yeah, so they're I guess two of the key things. And then when we're looking at people particularly with a kidney manifestation, so it's reducing the risk of kidney stones. The other thing that can happen is where the kidneys can become calcified in areas because of their elevated calcium. So we're wanting to reduce the risk of kidney stones, calcification and inflammation in the kidneys as well.
Okay. So what sort of diet then would you be recommending to people if they've been diagnosed with sarcoidosis with kidney involvement?
Yeah, so definitely an anti-inflammatory alkaline diet.
Yeah.
So which, alkaline diet is what we recommend for people with kidney disease anyway. So I wouldn't, that it would be the same really, because then you're also protecting the kidneys as well as working on reducing that inflammation and oxidative damage and the scarring and the things like that go along with it.
And any particular herbs or nutrients that you really love to use in this condition?
Yeah, so in terms of, I guess, looking at that particularly anti-inflammatory type action, turmeric or curcumin, and that's also antioxidant. Things like Romania as well, because it's anti-inflammatory, antioxidant, but also works on that immune modulation too. And then nutrients, things like fish oil, so omega-3 fatty acids, SBMs, particularly which are specialized pro-resolving mediators, which is a part of fish oil, particularly when we're thinking about wanting to switch off that inflammation, because as I mentioned, sarcoidosis is when that inflammation doesn't switch off and it gets out of control. So wanting to switch off that inflammation. N-acetylcysteine, lipoic acid, all of those antioxidant, anti-inflammatory type nutrients, which have the added benefit of being really protective for the kidneys as well as working on the inflammation.
And tell me why vitamin D testing is so important in people with sarcoidosis.
Yeah. So when we test vitamin D levels, we're testing the precursor to the active vitamin D. So it's 25 hydroxy vitamin D is what we normally test. In people with sarcoidosis, we can have increased levels of the active form of vitamin D. So that's 125 dihydroxy vitamin D. So let's say you go and just get a standard vitamin D test and it shows that your vitamin D level is low and you start taking vitamin D supplements. You may actually have already have elevated active vitamin D, you're then putting more vitamin D into the situation, and that's just going to increase that calcium absorption, that risk for high calcium levels in the blood, high calcium levels in the urine, kidney stones, and all those sorts of things. So what you do want to get tested, and what can be tested, is actual testing the active vitamin D, so calcitriol, the 125 hydroxy vitamin D, and basing whether you need any supplementation under the care of a healthcare provider on that level.
Yeah, I think that's super important, because I know people often with immune stuff are supplementing, but yeah, like you say, may not know that the increased calcium retention and then all the forming kidney stones is all part of that process. So, okay, so what else do we want to say about sarcoidosis? It's obviously treatable and successfully generally.
Yes, yeah. You know, a large, I guess, proportion of patients go into remission somewhere between sort of 2 and 5 years. So it is something that can go into remission, and they tend to find that, I mean, obviously, you know, there's always the risk with anything that it can reoccur, but it doesn't seem to be a condition that has a high risk of recurrence. So you may have had one presentation of sarcoidosis, gone into remission. It doesn't necessarily mean that it's going to happen again. Okay,
well, that's good. All right. Anything else that you want to say about sarcoidosis?
No, I don't think so. I think just I guess a couple of key things is making sure that you're getting your calcium levels, your blood calcium checked, and your urinary calcium checked as well, just to assess that, as well as the vitamin D, like we spoke about.
Yeah. Okay, great. All right, well, hopefully that gives you all a little bit of information about sarcoidosis. It is definitely a lesser known cause of chronic kidney disease, but I know from emails we do have a few people out there with sarcoidosis, and we would normally see it in clinical presentation in the eyes and the lungs, but it definitely can affect the kidneys there. So if you have been diagnosed with sarcoidosis, make sure you reach out to a qualified healthcare practitioner, but also know it seems to be some good news with it. Anti-inflammatory diets and being able to switch off that inflammatory cytokine process will definitely help alleviate it. And if you go into remission, good news, probably not likely to recur, which is great. So thanks again, Emily. I really appreciate it. If you've liked this content, make sure you give us a like. And if you hit subscribe, you'll get notified anytime we put up new content. If you want to know more about who we are and what we do, you can head over to www.kidneycoach.com, and you'll find everything you need to know about us on that website, including supplements that we sell and our program, the Kidney Disease Solution. Emily, thank you again for all your valuable information and knowledge. I always appreciate it. And we'll all see you next time. Bye.